importance of tissue banks, and that fits nicely in the discussion about pathology, cannot be overestimated. It's for the community, it's very important, but it's also becoming of more and more importance for patients with the arrival of targeted therapy medicines, because maybe in the future there will be some drug for a target that's in your tumor that hasn't been found yet. So having your tissue preserved is not only in the interest of research, but also in your own interest. Of course, we have a lot of problems to solve regarding to tissue banks, considering ownership, considering legislation, the European rules on data, the data directive, or how it's called. But I think patient organizations can come in here and can assist the professionals, can work together with the professionals to improve the biobanking for all types of cancers, not only for the rare cancers. Of course, the normal things we can do, and we are already doing, most of us, is recruit patients, give them information about the importance of donating their tissue to biobanks. The second thing is, of course, try to influence the regulatory offices, the politicians, about silly things coming out of rules meant for other purposes. The entire data directive, of course, is more targeted towards information, towards the internet. But when you're creating a biobank at this moment, it's a burden because of some laws not meant to influence medical things. And the other thing, you could set up a biobank as a patient organization yourself. It's done. We do it in the US, and it can be done. Of course, we don't have a freezer in our garage, but we are organizing it. Something important to remember, if the professionals don't do it, take the initiative as a patient organization.
I don't know if you know about the Path Tumor Tissue Bank, but what they do there is they put aside a piece of every patient's tissue in a kind of separate bank for that patient, so that that patient in the future can have a piece of their tissue if there are new developments in treatment, if there are new treatments specific to using tissue. And it's like putting money in your own bank account. And I personally think this is a great idea, and I think it also is an acknowledgement of the contribution that patients make to research in terms of getting their tissue as part of a tissue bank.
And I was behind setting up the first tissue bank in India, the Icon Tissue Bank. So first thing is that when we start a tissue bank, there is a question of the consent form. That consent form is very different from the treatment consent form. You just can't keep a tissue and say, tomorrow if I have a test, I'm going to do the test. No, the consent has to be taken for it. So question is, and that tissue bank has to have also a privacy. Coming into the registry part that was raised, patient advocacy groups can start a registry, but please remember, there is an issue again, and the issue is maintaining confidentiality. Who is going to have access to this tissue? Who's going to have access to the data? That becomes extremely important and has to be kept in mind. Clinical trials, we know something, yes, patient advocacy groups have a place, definitely. But we need to know that when we don't actually see cross-purposive. I know of a patient advocacy group in India that has brought the clinical trials industry in India to a grinding halt. So we have to find out that whether the advocacy group did the right thing. It was not. Because we know all those deaths in that particular trial was really not related to the drug, but they made it appear that way. So we need to be tempered, be more logical when we approach any of these issues and we take it forward.
We have a new initiative in Europe, which is the BBMRI Erik. It's a European research infrastructure, which is something that is very exceptional, and the Commission does not often grant this. This is a collaboration across Europe of more than 300 tissue banks. They follow certain quality control. They have procedures for data monitoring. What is so special about this is that if a researcher in Italy accesses the database of BBMRI and he's looking for a specific tissue and it is in Ireland, he will find it. Well, not in Ireland. Ireland is not a member of the BBMRI. So if you want to create a database and a tissue bank, it will be much more effective if you add it through your national node, because in every country, because this is again financed by the member states, if you go and contact your national registry, cancer registry, and they will know where the node is, and they will bring you in contact, or your clinician, and make sure that your tissues are not sitting in vain in freezers, because the only good tissue is tissue that's being used. Tissue in the bank without data, for instance, if there's no data linked to your tissue, it will never be used. It can only be used if it's fully equipped with data and available through the website to the researchers who need it for their research.
I am a board member of the steering committee of the Finnish Hematology Biobank. I've been from the very beginning of that, about 3 years ago it started. And I'm very familiar with the questions that you set up. We got a new law in Finland in September and, about biobanks. And it raised up all of those questions. And the privacy of a person, of a patient, is one of the most important things there. We have to get permission from the person to get those tissues to the bank. And before the law, it was that you can get the permission only for very, very certain research, that you have to know it in before. But nowadays, the law of biobank says that it's a wide permission, that you can get, you can let researchers do in that area where the biobank belongs to. And we are setting up a website at the moment for that. We have to get permission from the state authorities to move all those issues that have been taken before the law became effective. And we are working on that at the moment. So actually, the biobank that's working along the law starts in the beginning of next year. We are still preparing all those things that we can get it to there. But it's a hard work to do all of that.
Hans, I'm going to put you on the spot and ask you if you have any comments in response to the issue of privacy, for example, and one-time consent or sustained consent or whatever.
Well, the problems with biobanks is that you want a sustained consent because you don't want to get to the patient, to get back to the patient every time that you reuse the tissue for research. It would be a very big burden and it would influence research very much. So, but you should have the data of the patient anonymized in such a fashion that should not be necessary from a privacy point of view. Of course, from a legislative point of view, there are things changing at the moment in the European Union, and it could be that in future we have to ask patients for a consent every time we use the tissue.
The tissue banking is a question of money. It helps only for research, but it can help individual patients. So once he has tumor in a bank and he has metastatic disease and needs a second look, reference pathology or look on the target. Now probably target is treatable or druggable, which has not been 2 years ago when the tissue went in the bank. So these are the situations where it's important, good, to have tissue bank or have the tissue of the tumor in a bank or in a pathologist which is reachable. The problem is mostly the tissue is not available anymore, not in good condition, not ready for molecular analysis, all these things. So it's good for the patient to have a tissue bank. However, there are only very little tissue banks in Europe. in Germany, I think 2% of the tissue is going into a bank, is only in research areas. So it's not a normal thing, not a standard thing. But those patients who have the chance to get this tissue in a bank out of the normal pathologist, you should do it because it's great, and you should be sure it's only used if necessary and not without your will, because it's clearly said. It's controlled by the law that it's not used out of official use, out of accepted, ethical, proven use. It's clinical trials.
The word action is in our title for this group, and I would very much like to challenge the meeting actually to put action into action, to actually do something about what we're talking about. And I'm particularly thinking about the seriousness of the situation, not least with clinical trials, where it is getting more and more difficult to actually run clinical trials for lots of different reasons. And I would challenge the group here, instead of just talking about this, would it not be a very good headline in the newspapers to say that the biggest organization of patient cancer advocates called upon the European Commission to treat the issue of tissue banks and of clinical trials as a public health issue, and to do a major inquiry and action point to bring about better care for patients through addressing these points. In other words, why don't we have a show of hands occasionally, just to say how committed we are to what it is that we actually believe in. And then through that showing of hands of the organizations who are in this room, and that must represent an awful lot of cancer organizations, to demonstrate to the media, to the press, and to the politicians out there that we take this very, very seriously, as they should as well.
Thank you for those rousing words. Let's see a show of hands. How many organizations here today would support Ian's idea? Think it's a good idea? Please raise your hands nice and high. That's an awful lot of organizations. And Ian, you're in charge of organizing that. But I think it's an excellent idea. And as you say, we don't just want to just talk about the issue. We want to take some action, because that is the whole purpose of this particular session, to come up with action points. So thank you very much.